If you're a woman who is literally doing everything possible to have and promote a good health and a body, you are eating well, you're exercising, you are seeing specialists, doing blood work, you're taking supplements, perhaps hormonal therapy, you are seeing even a psychotherapist to help you with your mind, and you're noticing that you are still struggling with burnout, exhaustion, chronic pain, migraines, gut issues, IBS issues. And no matter what you do, you don't seem to get ahead of it. This video is for you. My name is Valerie, and I'm a mind-body coach and a migraine expert, and I specifically work with high-achieving women. I was inspired to do this video today because I went to this wonderful networking event last night and met wonderful women that are all there to advocate for their health and learn specifically about perimenopause. And I know this is a big thing right now. There's a lot of awareness about it, which is fantastic. But I also sense this energy of frustration, overwhelm, and hopelessness in the room because we talked a lot about what is out there, what are the common symptoms that are really becoming dominant, and how can we address that. But when we talked about the solutions, and it was actually driven by a documentary that we watched, it was all focused on what we needed to do more and pay attention of. So for example, really focus on exercise, eating well, strength training, taking hormones. I felt like we were pretty much doomed to live in a body where our hormones are fluctuating and we have no control over this. I'm here to tell you that the reason you're struggling has nothing to do with what you are doing and not doing. It's not your body that is broken. It's definitely not genetic. You are not going to be living like this for the rest of your life. The biggest problem is our conventional medical model is missing one of the biggest, most important piece of the puzzle. And that's what I'm going to talk about today. I want to be clear here before I move on. I am not doing this to criticize or dismiss our conventional medical system. And I'm certainly not here to invalidate your experience. In fact, I was trained in that system for many years and I value it and I highly respect it. What I'm here to do is to shed some light and expand the conversation about what is often most overlooked so that you can become aware of it and that you can regain a sense of agency and empowerment over your health. When you experience a physical symptom, whether it's chronic burnout, fatigue, a physical pain, migraine, crazy mood swings, it doesn't honestly matter. When you experience something going on with your body, what we all do is we go see a healthcare professional. So I want to show you what that looks like from a bird's eye point of view. We typically go see a health professional and we get assessed. With the assessment, that could be blood work, it could be MRIs, imagery, physical testing. It's always something related to the body and the structure and the organs. Once we do the testing, then we get a diagnosis. Once we get the diagnosis, then we are given options for treatments, solutions. And most of those approaches, if you pause for a minute and think about it, are always related to the body itself, to the structure itself. So you're either going to be provided medication, perhaps supplements, hormonal therapy, a change in your food, in your diet. When it comes to the body, you are probably recommended to go see a physio, a chiro, a massage, acupuncture, alternative medicine, doesn't matter, but something related to the body, perhaps your recommended surgery. Then also we include exercise. The exercise is so important. We must move every single day. And if you are feeling overwhelmed, depressed, or something emotionally or regarding your mental health, we are then going to see someone in this specialty. Our body has roughly 11 systems. I've listed just the most common ones that you would be aware of. Your immune system, your hormonal system. We have our gut system, so the gastrointestinal system. Muscles and joint, that's your musculoskeletal system. That was my specialty. Brain, heart and lungs, and so on. So when we have a problem regarding any of those symptoms, we go see someone to get it looked at physically, and with a diagnosis, we are then provided a solution from a bodily structural lens. All right, let's jump into the missing piece. I did a diagram here to simplify this as much as possible. Nobody talks about the mind-body connection. The mind-body connection is the connection between your brain and your nervous system and your body. Our medical system is designed to treat the body simply right now, specifically through that lens. But what's truly happening in our body, the way in which our body actually operates, is that we have the brain and the nervous system, and they are the command center of your whole body. They are in charge of the operation happening here. Your brain is fueled by your thoughts, your beliefs, and the meanings that you give to the world, to yourself. And it communicates directly to your nervous system. And your nervous system is fueled by your emotions, your experiences, and traumatic events, and also your environment. So the way in which you feel will automatically communicate to the brain and vice versa. And then they will automatically give direction to your body to respond accordingly. This is the key piece here. Your brain and nervous system, their primary role is to keep you safe. So if it senses a threat, and to simplify this, I mean fear. Fear is the emotion that will send a signal to your brain and nervous system that there's something wrong with you. So as soon as we feel a little bit more anxious, worried, stressed out, exhausted, burnt out, overwhelmed, we're putting a lot of pressure on ourselves, we're criticizing ourselves. That is actually fueled by fear. So your brain and nervous system senses that fear, and it will directly send a signal to your body to respond accordingly, to either fight or flee the situation or freeze and fawn. Those are the 4 states. So this is why you're probably feeling stuck. No matter how you do this perfectly, no matter how well you treat your body perfectly, if you have constantly in the background feelings of overwhelm and stress and not being good enough and fear and anxiety, and perhaps you've experienced some trauma in the past that you've never dealt with, and that suppressed a lot of emotions in your body, and perhaps you have a belief system about you, about your health, or about life that's very fear-driven or lack-driven, that is what's controlling everything. So this will keep your body in survival mode regardless of what you do here. You're probably noticing that you're relying on medication, relying on certain exercise, relying on certain treatment approaches to keep you basically in survival mode. So here's the good news. This is all in your control. The good news is you do not need to add more things to do on your list, to do more exercise or avoid or restrict your triggers. What I always tell my clients is we need to pause for a minute and just start becoming aware of your own thoughts and beliefs that you have about you, your body, your health, and notice also how you feel. When you start becoming aware of this and you start to shift this, your body will simply follow. So the key thing here is to regulate the nervous system. You've probably heard this term, but we basically want to teach your body that you're safe. And once you bring your body into the safety realm, then your symptoms automatically dissipate. I'm going to share with you 2 simple things that I invite you to do today, every single day, that's going to make a world of a difference for your nervous system. The first thing is you must stop trying to fix yourself. You must stop assuming that there's something wrong with you and that there's something wrong with your body. And when you take action from a place of fear, from a place of not enoughness, from a place of I need to do this way in order to be healthy, that is what's keeping your nervous system stuck in survival mode. So the first thing is stop that, okay? Shift your focus on trusting that your body is actually simply trying to communicate with you that it's sensing you're in fear, that you are in survival mode. The second thing is I want you to carve in your day, and that can be as short as 5 minutes to up to an hour. It's really up to you. There is no one size fits all, but carve some time every single day to reconnect with you, with your soul, with your body. Do something that brings you joy, that brings you pleasure, that brings you calmness and peace. That can be walking in the woods, having a bubble bath, doing some meditation, going to a dance class. It doesn't matter. You choose an activity or something that brings you joy, calm, and peace, and that makes your body feel safe. And the more you do that, the more your nervous system will start to get the message.